Hi, my name is Abriana Johnson. I'm a Doctor of Nursing Practice student here at Montana State University, and I am going to talk to you today about the Vanderbilt screening test for attention deficit. So the background, we're trying to get these pediatric population diagnosed is primarily through primary care providers, as 70% of all the pediatric population gets seen annually. Of all primary care providers, only about 8 to 20% actually report having advanced training in any sort of child psychopathology. Therefore, it makes it pretty difficult on that provider to feel comfortable prescribing or diagnosing any sort of mental health disorder for a child, and therefore gives more time constraints and more referrals, and before you know it, we're a few months out getting that kiddo diagnosed with the correct disorder. And of the pediatric population, 9.5% of all peds actually are diagnosed with ADHD. So some barriers, I kind of touched on that on the previous slide, but it's mostly time constraints. We're all about getting more efficiency and higher productivity in any aspect of the healthcare system. So the providers just don't have the time to be able to go in and assess the patient there for if they have ADHD. So as well as they're just improperly trained, they don't it's not as addressed in their residencies and in training, and so they're not as comfortable. As well as for a lot of parents, there's just that preconceived notion of the social stigma that your kid might have, that their child might have a mental health disorder, and it makes them anxious. And a lot of times parents don't even want to address the issue of their child potentially having some sort of a mental health disorder. As well as funding. Socioeconomic status always plays a huge role in any sort of mental health disorder, and for the typical presentation, the medications are very expensive, even with coupons and having all your follow-up appointments and everything like that. So it can get quite expensive quite quickly. So these forms are pretty standard. They're from the National Institute for Children's Healthcare Quality, or Children's Healthcare Quality. This is just a simple form to fill out, a scale of 0 to 3, and this is in particular for the parent. Questions 1 through 32. And then on the back side, they have the rest of the questions. And I got it off. This website has amazing toolkits to diagnose ADHD, and it's backed by the American Academy of Pediatrics. So kind of the description of the Vanderbilt test in general: it's a multidisciplinary tool that incorporates both home life and the teacher who knows the patient well. So it's really important to discuss with the parent that this teacher needs to be interactive with this patient. And most of the time that comes in your core subjects, whether it's science, math, or English. They spend the most time, as well as those are typically the courses students will show like a learning disability, or they struggle more and they're not as attentive because they're not as interested. So this Vanderbilt form just puts a way to quantify the ADHD symptoms, to be able to rank it on the 4-point Likert rating system, and be able to match numbers with yes, this kid scored positive, or no, this patient did not. So the 4 points are: do they have this behavior rarely, sometimes, often, or very often? There's 18 specific behavior symptoms that are linked with certain disorders. So the criteria to get an ADHD diagnosis has potentially 3 different subtypes. The first one is an inattentive subtype. So there's specific questions that are geared directly at inattentive items. And so 6 out of the 9 to be scored a 2 or 3, which a 2 is often and a 3 is very often. And so to be hyperactive with impulsivity, it's the same thing. 6 out of the 9 need to be scored a 2 or 3. So in order to get both diagnoses, you have to have 6 of each of the 2 subtypes of the inattentive or hyperactive. And that way, that will show he is a true ADHD patient versus, well, he's just a little impulsive, so let's work on those behaviors with some counseling, per se. So just a simple sample question for the inattentive subtype is this patient easily distracted by noise or stimuli? Rarely, sometimes, often, very often, and that will just kind of give you the range. And all these questions have different categories on how to diagnose a patient, how to answer these questions. So what's awesome about the Vanderbilt in particular is very user-friendly. It's very simple and straightforward, but it also identifies a few other disorders that could be missed or could be the underlying reason why this patient is presenting to the clinic to be evaluated. So it can show that they're having relationship issues, whether it's with family or peers or with their teachers, and that's for both on the teacher and family, parent, informant. The classroom behavior is obviously on the teacher informant, and it'll show, is he acting out, is he being impulsive, is he just distracted continually, and then academic performance is rated by both the parents and the teacher, as the teacher can see how well they're doing, and the parents kind of rate how homework's doing at home. And then ODD can be kind of diagnosed, the oppositional defiant disorder, as well as conduct disorder, anxiety, and depression. And if those come up positive, then those need to be addressed by the provider and then continue on. So the typical presentation is usually through a referral process. Either the parents are like, oh man, they come home and they just cannot even stay focused to get their homework done. We try to have a conversation and they can't sit still long enough to visit or sit still through dinner. And then the teacher typically will send a letter home to the parents stating it might be something that needs to be addressed because they're not able to focus on that task at hand for more than a few minutes. And when the patient is seen in the office, he or she will have a difficult time maintaining the focus throughout the interview process and the assessment. And those you can tell that they're unmanaged, or they need to have an increase in a medication dose, or start them on some sort of a pharmacotherapy. And a lot of times they're just struggling with social situations, with people, and so much stimuli, and they have a hard time creating meaningful relationships with their peers because they just don't see how they get distracted when they're trying to interact, and that's hard to create friends that way. So kind of the background etiology with all of this is a lot of times they had a lingering brain injury, and whether it was they fell and hit their head when they were really little, but it wasn't serious in the sense of getting hospitalized, but they could have just hit their head, and a lot harder than anyone expected. Also, exposure to chronic low lead levels, which isn't quite as common anymore due to the restrictions on lead-based paint and all those kind of things. So it's always important to check a lead level when these patients come in if there is an exposure. There's also been links for prematurity and any obstetrical complications, which typically, your brain isn't quite as matured. You might have had an anoxic brain problem. You might have been a little hypoxic coming out. Cigarette exposure in utero, therefore, again, blood flow isn't as great to the fetus, and malnourishment has been huge. Seen, and that's where we're tying back into the socioeconomic status and funding is, are they just not eating good food and they're malnourished, and so they're also hyper and they don't understand those things, and then obviously meningitis or encephalitis has also been shown a leak. So in regards to sensitivity and specificity, there's really no hard cold rule about it. Either they're positive or they're negative. And it's not like an antibiotic where you need to get specifics with what's resistant and what's not. So in order to be positive, both respondents, the teacher and the parent, need to validate 6 of the 9 behavioral symptoms criteria in one or both of the categories for that ADHD diagnosis. And it's pretty straightforward. The provider calculates it based on the rules that are on the Vanderbilt, and in different categories get weighed heavier, and is an average between the teacher and the parent. And it's been kind of interesting looking at some Vanderbilts and reading about researching this, in the sense that they found a lot of teachers want these kids to be diagnosed with ADHD and get them medicated, and then the parents don't see these behaviors at home. So that's been an interesting little find I learned about. But in regards to cost-benefit ratio, it's very inexpensive. It takes just the time to print off the paper, and the time for both the parents and the teacher to fill out the forms, and for the provider to go through and score the two informants. So honestly, the benefit far outweighs the cost in getting this patient either into therapy or on medication, and so he or she can interact with their class and their family in a lot more respectful manner. So in regards to recommendations, the American Academy of Pediatrics highly recommends using the Vanderbilt screening tool when they're exhibiting signs of ADHD. You can get a diagnosis from that, as well as those other mental health disorders that we went over earlier. It just provides such great information, and is fast and efficient, and is extremely accurate, and it's kind of the gold standard right now. And I also recommend mailing the forms out before the appointment if the parent can understand what needs to be done, and so that first initial appointment can just streamline everything and already have all that assessment information done, and therefore if the patient scores positive on the Vanderbilt, they can get him or her started on medication and get his or her problems corrected, and hopefully do better in school and not have the learning difficulties that they were experiencing due to the not able to focus. So it's a pretty cool little tool. It's very simple and straightforward, and it should be used in all primary care offices. And there's my